Okay, good morning, Elaine.
Hi, Donnie.
Thank you for coming in. Appreciate your time today and wanted to visit with you a little bit about celebrating 50 years
Hmm.
of the 50-year anniversary of this center. And I know that you spent some time here and
A
wanted to
little
get
bit.
a little bit. I wanted you to let us know a little bit about what you did here, a little bit about your career, maybe leading up to when you were here, and then also some of the, just tell us a little bit about yourself, and then but also kind of maybe some projects that you were involved in and in the different capacities that you worked in.
Okay. Well, I was in extension for 38 years, a little over 38 years, and I started out as an extension agent with the expanded food nutrition program. Then was an agent
Mm-hmm.
um, for Family and Consumer Sciences. Moved into a project manager role with AmeriCorps for about 4 years there. County Extension Director in Bexar County. And I was asked one time in one of those interviews, can you not hold a job? But Extension offered a lot of opportunities. And then very happy that I had the opportunity to come to Corpus Christi as the regional program leader. Served in that for 9 years.
What year did you come?
I came in '06.
'06. Okay.
'06, served in that role for 9 years, and then moved into the Healthy South Texas Assistant Director for 7 years.
And you retired in what year?
22,
22. In
2022.
2022. Okay.
Time flies.
Well, yeah. Well, tell us about some of the projects that you worked with in family. Now it's Family Community Health. Back then, probably Family Consumer Sciences.
Right.
Those have changed over the years, and over the
Mm-hmm.
50 years, actually, the titles of the professionals working in counties also have changed too.
Right.
But tell us some of the projects that you thought were really impactful coming out of this center while you were here.
Okay, I would say as regional program leader, one of the things I was very proud of was building teams with the district extension administrator in counties that included family and community health
Yeah.
agents and 4-H agents. And so I think part of the proud moment is building those teams and then building capacity and training with those agents so that they can deliver impactful programs that make a difference in their community. We did a lot of programs that were based out of this center. We covered 3 districts at that time when I first got here, 9, 11, and 12. But with agent input and support, we brought in the Maintain No Gain program. We worked on nutrition programs that could be used. Families reading every day. We worked on building that up in different areas. I'm very proud of how we did a lot of child development and training for child care center staff. A lot of things were going on in family and community health.
Good, good. And what about Healthy South Texas? How'd you end up with another opportunity here later in your career with Healthy South Texas? I know that was definitely right here in this
Right,
district.
and that was 7 years. And so, with state funding, Healthy South Texas was born, and Corpus Christi was the center of that, serving 27 counties. And I guess I was already here and already knew the territory in the area. And Dr. Balabina approached me because she knew I had a passion for this kind of work, and I had the opportunity to take on the role. What was exciting about that is we were able to hire and train a team of health specialists that had a lot of good background and experience, and they were strategically placed around the 27 counties, which was something very different. And because we did not have that luxury of having a lot of specialists embedded close to the
And those
counties.
Family Consumer Sciences agents, actually at that time, was part of why they changed their title as well, if I'm not mistaken, from Family Consumer Sciences agents to Family Community Health agents. And then we actually hired some health agents.
Yes.
I believe probably the first health agent in the state was hired here in Corpus Christi, here in Nueces County, and providing support from the the specialist that you actually supervised.
Right.
Um,
That was also exciting that I was able to hire and then train and support and mentor. And then they worked with the agents, and I did too as well. But we were able to develop a lot of educational initiatives through that program. Um, I mean, we developed extra Cooking Well suite of programs, Dance Fit. We had Walk Across Texas. That was already in force, but we really were able to help bring that into this area even more so.
One of the things that were really already in focus or already had been done by the agents in other parts of the state that actually took off here is Dinner Tonight. And the Dinner Tonight projects that the Healthy South Texas initiative, worked with. That tells a little bit about Dinner Tonights and how that has worked.
Dinner Tonight, those are cooking schools, and so they're high energy, high impact cooking schools where community is invited to come in, participate. We develop different programs to go with that, such as do with diabetes education, with the Mediterranean.
So some were targeted towards diabetes education,
right,
or eating well with diabetes,
right,
and how to manage that,
right,
through your diet.
And so the agents promote those in the community, and then we have nice crowds that come in. They get actual demonstrations, they get recipe books, they get to taste, and part of that is the fact that if you can show people how to do it versus just telling them, it's just the extension way. You show them, then you let them try it and taste it. They're more likely to go home and
then also with
it.
Healthy South Texas, just the same way that research and extension work here on row crop production or agriculture as per se here in this area. We also connected with the Health Science Center, and the Health Science Center did their research, and we assisted in outreach there, didn't we?
Yes, that was a very unique partnership that had not been done before in partnering with the Health Science Center. So they brought their expertise from that end in diabetes, and they did more of the diabetes education. We did more of the practical information on the food preparation and kind of building those programs together to make more impact for people and let them practice what they were learning and putting into practice, because that helps them in their life.
One of the last things I wanted to visit with you about today is tell us a little about your relationships with coworkers, relationship with the team approach, with the people you worked with here and the specialists and across the state actually, but obviously here there's been a team approach that has been significant over the years. Tell us a little bit about what that meant to you.
To me, you cannot do this work in extension without being part of a team. We were team members together for quite a long time. And I think that is how you really bring those different ideas and different perspectives, different diverse ideas, and really bring it to where you can come up with a good product. And a big piece of that is what can we develop in all the different programs, and this, and also during the regional program leader years, how can we develop things that can be relevant in the community, take it to the community, build capacity with agents so that they can help deliver it in the community. And that all takes teams. You can't do that by yourself. You can't be successful if you're a lone person. And so to me, teamwork was really important. I valued our time as co-workers and team members. There's just no way in extension you can do it. And I would also say building those teams in the community is also very important. So when the agents are building the teams with their committees, with their partners, again, they could not be successful without that community input. The other thing I wanted to mention, Donnie, is I think when we look at family and consumer sciences, or now family and community health, we go way back in bringing that agriculture and food together. And when you think about the producers and the projects that were going on in the center here, and then bringing in the health aspect of it, bringing all that together, because people are not just ag producers, they're also family members, they're also parents. And so looking at that kind of family more holistically is something that's really important, to where you can have a more synergism.
Well, that
within the
goes all the
family.
way back to
Way back.
the start of home economics
Mm-hmm.
in the home, obviously, and then from there going to home demonstration,
Yes.
teaching the home, teaching individuals in the home how to do things a little bit better, and trying to do that as well. And then obviously to family consumer sciences, family community health now.
Right.
So it really goes all the way back, and the same model has worked for many years.
For many years. And I think that's just so important, to look at people as there's many different components in their lives. And I think what's exciting to me about Extension is that we can touch all those aspects of it and hopefully make a difference. And we've seen people change and families change and become stronger and healthier.
Well, thank you, Elaine. Thank you so much for taking the time to come in.